Respiratory alkalosis is a medical condition in which increased respiration elevates the blood pH beyond the normal range with a concurrent reduction in arterial levels of carbon dioxide. This condition is one of the four basic categories of disruption of acid-base homeostasis. Terminology: alkalosis refers to the process due to which there is elevation of blood pH more than 7.45. Alkalemia refers to an arterial blood pH of greater than 7.45. Classification: there are two types of respiratory alkalosis: chronic and acute, as a result of the 3 to 5 day delay in kidney compensation of the abnormality. Acute respiratory alkalosis occurs rapidly. For every 10 mm of mercury drop in pCO2 in arterial blood, there is a corresponding 2 MEq/L drop in bicarbonate ion due to acute compensation. During acute respiratory alkalosis, the person may lose consciousness where the rate of ventilation will resume to normal. Chronic respiratory alkalosis is a more long-standing condition. For every 10 mm of mercury drop in pCO2 in arterial blood, there is a corresponding 5 MEq/L drop in bicarbonate ion. The drop of 5 MEq/L of bicarbonate ion is a compensation effect which reduces the alkalosis effect of the drop in pCO2 in blood. This is termed metabolic compensation. Signs and symptoms. Signs and symptoms of respiratory alkalosis are related to the decreased blood carbon dioxide levels, and include peripheral paresthesia. In addition, the alkalosis may disrupt calcium-ion balance, and cause the symptoms of hypocalcemia with no fall in total serum calcium levels. However, chronic respiratory alkalosis leads to hyperphosphatemia and hypocalcemia, by inducing renal PTH resistance. Mechanism: respiratory alkalosis generally occurs when some stimulus makes a person hyperventilate. The increased breathing produces increased alveolar respiration, expelling CO2 from the circulation. This alters the dynamic chemical equilibrium of carbon dioxide in the circulatory system, and the system reacts according to Le Chatelier's principle. Circulating hydrogen ions and bicarbonate is shifted through the carbonic acid intermediate to make more CO2 via the enzyme carbonic anhydrase. According to the following reaction, the net result of this is decreased circulating hydrogen ion concentration, and thus increased pH. There is also a decrease in ionized blood calcium concentration. Causes: respiratory alkalosis may be produced as a result of medical treatment during excessive mechanical ventilation. Other causes include psychiatric causes, anxiety, hysteria and stress. CNS causes: stroke, subarachnoid hemorrhage, meningitis. Drug use: doxapram, aspirin, caffeine and coffee abuse. Moving into high-altitude areas, where the low atmospheric pressure of oxygen stimulates increased ventilation. Lung disease such as pneumonia, where a hypoxic drive governs breathing more than CO2 levels. Fever, which stimulates the respiratory center in the brain stem. Pregnancy. High levels of NH4+ leading to brain swelling and decreased blood flow to the brain. Vocal cord paralysis. Compensation for loss of vocal volume results in overbreathing and breathlessness. In popular culture. In the Andromeda strain, Michael Crichton's first novel published under his real name, only 2 people exposed to a pathogenic extraterrestrial microbe survive. Scientists investigating these survivors discover that each had abnormal blood pH. 1. A baby, had respiratory alkalosis due to constant crying. The other, an old man, drinks sterno. As a result, it becomes clear that the microbe cannot survive outside a narrow pH range.